What if I told you that your heart could be asking for help weeks or even months before a heart attack happens? Not with traumatic chest pain, not with a sudden collapse, but through small, everyday changes that most people over 50 dismiss as just getting older. The frightening part? Many people don't recognize these warning signs until it's too late. Today, I'm going to show you what cardiologists wish every adult over 50 knew before a heart attack ever happened. Stay with me, because the last warning sign surprises almost every patient I meet, and it could save your life.
Hello viewers, I'm your AI doctor, Dr. Hanry Paul. Welcome to my channel. Here, we explore important health topics, uncover the causes behind common medical conditions, and share practical science-based tips to help you live a healthier life. Whether you want to prevent disease, understand your symptoms, or improve your overall well-being, you're in the right place. So, subscribe to the channel, and let's begin your journey toward better health together.
A few months ago, a 58-year-old man came into my clinic. Let's call him David. David didn't think anything was seriously wrong. He wasn't experiencing crushing chest pain. He wasn't short of breath all day. He wasn't collapsing. Instead, he simply felt different. He told me he'd been getting tired much faster while walking his dog. Climbing stairs suddenly seemed harder. He blamed getting older. His wife noticed he looked pale and often stopped to catch his breath, but David laughed it off.
I guess 58 just feels different, he joked. A week later, while carrying groceries into his house, he felt pressure across his chest. Not severe, just uncomfortable. He rested for 10 minutes. The discomfort went away. He almost didn't tell anyone. Fortunately, his wife insisted they visit the emergency department. Tests showed that one of the arteries supplying blood to his heart was almost completely blocked. Doctors treated him before he suffered a major heart attack. Had he ignored those earlier signs for another few weeks, the outcome could have been very different. That experience reminded me of something I see again and again. The biggest danger isn't always the heart attack itself. It's ignoring the quiet warnings beforehand. And that's where our first sign begins. One of the earliest complaints I hear is surprisingly simple. People tell me, "Doctor, I just don't have the energy I used to." Most assume it's normal aging. Sometimes it is. But sometimes your heart is quietly struggling. Think of your heart like the engine of a car. When the fuel lines become partially blocked, the engine still runs. It just can't produce the same power. Your body works the same way. When narrowed arteries reduce blood flow, your heart has to work much harder to deliver oxygen throughout your body. The result? Simple activities suddenly feel exhausting. Walking the dog, gardening, carrying groceries, even making the bed. According to the American Heart Association, unusual fatigue can appear days or even weeks before a heart attack in some people, especially women. That doesn't mean every episode of tiredness signals heart disease. Far from it. Poor sleep, stress, anemia, infections, and many other conditions can also cause fatigue. But if your energy has changed noticeably without a clear explanation, it's worth discussing with your healthcare provider. Here's what I recommend. Take a brisk 20 to 30-minute walk most days of the week if your doctor says it's safe. Aim for 7 to 8 hours of quality sleep, and keep track of changes in your stamina. Your body often notices patterns before you do. Here's something many people misunderstand. Movies have convinced us that heart attacks always begin with someone grabbing their chest and collapsing. Real life is often much quieter. Many patients describe it as pressure, tightness, heaviness, or feeling like someone is sitting on their chest. The sensation may last only a few minutes before disappearing. That's exactly why people ignore it. Imagine stepping on a garden hose. Water still flows, just not as well. Your coronary arteries, the blood vessels feeding your heart, work the same way. When plaque narrows these arteries, blood can still reach the heart. But during exercise, emotional stress, or heavy meals, your heart suddenly demands more oxygen than those narrowed arteries can deliver. That's when pressure or discomfort may appear. The Mayo Clinic explains that chest discomfort during activity that improves with rest can be a sign of reduced blood flow to the heart and should never be ignored. If chest discomfort is severe, lasts several minutes, or is accompanied by shortness of breath, sweating, nausea, or pain spreading to the arm, jaw, neck, or back, seek emergency medical care immediately. Simple habits matter too. Know your blood pressure, manage cholesterol with your healthcare provider, and if you smoke, quitting is one of the most powerful ways to reduce your heart risk. Now here's where many people get fooled. You don't need chest pain to have heart trouble. Sometimes the heart sends a completely different signal. Shortness of breath. I've had patients tell me they suddenly needed to stop halfway up the stairs. Others couldn't finish their usual walk. Some noticed they became winded while talking. Most blamed aging. But here's what many people don't realize. Your lungs and your heart work as a team. If your heart can't pump efficiently, oxygen delivery throughout the body becomes less effective. Think of it like a water pump feeding an entire neighborhood. If the pump loses power, every house receives less water. Your muscles begin asking for more oxygen. Your brain notices, and you instinctively breathe faster. The National Heart, Lung, and Blood Institute notes that unexplained shortness of breath, especially during physical activity, can be an important symptom of heart disease. If this change is new, persistent, or getting worse, don't ignore it. Continue being physically active if your healthcare provider advises it, maintain a healthy weight, and schedule a medical evaluation to determine the cause. Before we continue, I'd like to ask you something. Have you noticed even one of these warning signs in yourself? Maybe unusual fatigue, shortness of breath, or discomfort that didn't seem quite right? If so, type yes in the comments. I read as many comments as I can because this channel isn't just about sharing information, it's about helping people recognize problems before they become emergencies. And if today's video is helping you, click the like button. It helps YouTube share this information with more people who may need it. Now let's continue, because the next warning sign is one many people overlook for years. Here's something that surprises almost every patient. A heart problem doesn't always cause chest pain. Sometimes the pain appears somewhere else entirely. I've had patients point to their jaw, others rubbed their left shoulder, some complained about pain between the shoulder blades. One woman told me she thought she had a tooth infection because her jaw hurt every evening after dinner. The real problem wasn't her teeth, it was her heart. Here's why. Your heart and parts of your neck, jaw, shoulders, and arms share many of the same nerve pathways. Think of it like several rooms in your house connected to one electrical circuit. If there's a problem with the wiring in one room, the lights may flicker somewhere completely different. Your nervous system works in a similar way. Sometimes the brain struggles to identify exactly where pain is coming from. Instead of feeling it directly in the heart, you feel it somewhere nearby. This is called referred pain. According to the American Heart Association, discomfort in the jaw, neck, shoulder, back, or arm, especially when it occurs with exertion or alongside chest discomfort, shortness of breath, nausea, or sweating, can be associated with heart problems. Never ignore new, unexplained pain that repeatedly appears during physical activity. If it becomes severe or occurs with other heart attack symptoms, seek emergency medical care immediately. One habit I recommend is paying attention to patterns. Does the discomfort appear while walking, climbing stairs, carrying groceries? Those patterns can provide important clues to discuss with your healthcare provider. Now let's talk about something that many people blame on age: poor sleep. But this isn't simply feeling sleepy. I'm talking about waking up already exhausted. You slept 7 or 8 hours, yet you feel as though you never rested. Most people assume stress is the cause. Sometimes they're right. But here's what many don't realize. Your heart continues working every second while you sleep. Imagine a water pump that runs all night. If the pump becomes weak, every room in the house receives less water. Your body works the same way. When the heart isn't pumping efficiently, or when conditions like sleep apnea interrupt your breathing, your body may not get the oxygen it needs during the night. Instead of waking refreshed, you wake up drained. The National Heart, Lung, and Blood Institute notes that untreated sleep apnea is linked with high blood pressure and an increased risk of cardiovascular disease. Simple changes can make a difference. Maintain a healthy weight. Avoid heavy meals and alcohol close to bedtime. Keep a regular sleep schedule. And if you snore loudly, wake up gasping, or feel excessively tired despite adequate sleep, speak with your healthcare provider about whether a sleep evaluation is appropriate. Before you go, here's one important reminder. Never ignore unusual symptoms, and always consult a qualified healthcare professional for proper diagnosis and treatment. If this video helped you, give it a thumbs up, subscribe to the channel, and share it with your family and friends. It might help someone you care about. I'm your AI doctor, Dr. Hanry Paul. Thank you for watching. Stay healthy, stay safe, and I'll see you in the next video.